Okay, let's dive in. Picture this for a second. You're looking at your furry friend, your pet, and suddenly their eye seems to be, well, popping out. It's a really startling thought, isn't it?
It really is.
Today on the deep dive, we're actually tackling a specific condition called proptosis, which basically means the eyeball moves forward and gets stuck.
And for you listening today, maybe you're trying to understand this topic clearly, maybe efficiently. Well, we've got you covered.
Yeah.
We've pulled together the really essential information to help make sense of it all so you can grasp what's important without, getting lost in too much detail.
Exactly. So let's start with the basics. What is proptosis, according to the information we have?
Okay, so it's when the eyeball itself shifts forward, but the key thing is the eyelids end up trapped behind the globe.
Behind it. Okay.
And the sources we looked at emphasize that this is often really sudden, acute, and usually linked to some kind of trauma or injury.
That trauma part seems key.
It is, and the material we're exploring today really gives a pretty thorough look at this condition.
So our mission for this deep dive is pretty clear then.
Yeah, I think so. We want to understand what causes it, what signs to look for, how vets treat it, and importantly, what the potential outcomes are, the prognosis.
Okay, good plan. Let's start with who is most likely to experience this. Our sources point pretty strongly towards brachycephalic breeds. Now, just to clarify for everyone, those are the breeds with the wonderfully flat faces, Pugs, Bulldogs, Shih Tzus, that sort of dog.
Right.
So why them? What makes them more prone to this?
Well, it really comes down to their anatomy. It's how they're built. These breeds, they tend to have much shallower eye sockets, the orbits,
Okay.
and they also usually have larger openings between their eyelids, what we call the palpebral fissure.
So less bony protection, kind of,
Yeah.
and more eye exposed.
Exactly. You've got it. So the main point here is that even things that seem like minor incidents, they can have really major consequences for these particular breeds simply because of how their skulls are shaped.
That makes sense. It paints a clear picture, sort of like their eyes are just naturally a bit more vulnerable.
That's a good way to put it.
But the information we have also makes it clear, doesn't it, that while it's more common in these breeds, proptosis can still happen to any animal.
Oh, absolutely. Yeah. If the traumatic force is severe enough, it can unfortunately cause proptosis in any dog or cat, really, regardless of their breed or head shape.
So it's about the force of the impact in other breeds.
Generally, yes. While we see it more often in those flat-faced breeds, even with smaller bumps, a really significant accident, like being hit by a car, could cause this in pretty much any animal.
Okay, so we know who's at higher risk. Now let's talk about recognizing it. What are the telltale signs? Obviously, the big one is the eyeball being pushed forward.
That's the most dramatic sign for sure.
But what other things might you see alongside that?
The sources give a really useful list, actually. We can maybe group them a bit. First, you might see bleeding.
Bleeding where?
It could be under the clear surface of the eye that's called subconjunctival hemorrhage, or it could even be within the eye itself, which is intraocular hemorrhage.
Both sound pretty serious. What else should someone look out for?
Changes in the pupil are another key thing. The pupil, the black center bit, it might be really large dilated or maybe very small, constricted.
Okay.
You might also see signs of inflammation inside the eye. That's a condition called uveitis.
Uh-huh.
And then there's the position of the eyeball itself. It might be deviated, pointing in an odd direction, or you might see strabismus, that's basically crossed eyes, or in a really bad case, the globe might even be ruptured.
Wow. Okay.
Yeah.
Those are some very clear visual cues. Anything else?
Yes, unfortunately, there can be more. The cornea, that clear front window of the eye, could get an ulcer, might look really dry, desiccated.
Right.
You might also notice other injuries right around the eye socket, like bite wounds, maybe.
From a fight, perhaps.
Could be. And because this is so often linked to trauma, you have to consider there might even be fractures of the bones around the eye socket or other skull fractures. It really underlines how serious the initial event might have been.
And it's not always just about the eye area itself, is it? The trauma could be wider.
That's a really important point,
Yeah.
yes. Because a significant injury can affect the whole body. There might well be other injuries elsewhere. And it's also crucial to check the other eye, too, because it might have been injured in the same incident.
So trauma, injury seems like that's the main driver here. Can we dig into that a bit more? What sort of injuries typically cause this?
Injury is definitely the number one cause. What's quite interesting, though, is how the level of force needed can really differ depending on the breed.
Okay.
In those brachycephalic breeds we mentioned, the ones with the shallow sockets, Sometimes even something relatively minor, like maybe struggling a bit during restraint at the vet or groomer, can actually be enough force for the eye to pop forward.
Really?
Yeah.
Just from struggling.
He's
That's
drunk.
wow.
Yeah, it sounds almost counterintuitive, doesn't it? That
Yeah.
those cute features actually make them so much more vulnerable in that specific way. It's a fascinating anatomical detail, really.
It is quite sobering when you think about it like that. And what about other types of breeds? The ones with longer snouts?
For breeds with deeper eye sockets like, say, a Labrador or a German Shepherd, it usually takes a much more significant force. We're talking things like being hit by a car, a serious fall, or a major fight.
Much more severe trauma then.
Generally, yes. The sources also mention a much less common cause, which is things like growths or masses behind the eye, retrobulbar lesions that can slowly push the eyeball forward over time. But trauma is the big one.
Okay, so primarily trauma, with certain breeds just being more susceptible even to minor incidents. Now, the text also helps differentiate proptosis from a couple of other eye conditions that might sound a bit similar. Could you walk us through those differences?
Sure, that's useful. It's important not to mix up proptosis with, firstly, buphthalmia.
Buphthalmia.
Yeah, that's when the eyeball itself actually becomes enlarged, bigger than normal. It usually happens quite slowly. It's rarely a sudden acute thing like proptosis.
Okay, so size change, usually slow. What's the other one?
The other is exophthalmia. Now, this is when the eyeball is pushed forward, similar to proptosis in that way.
Ah, okay.
But the reason is different. It's usually because something behind the eye is pushing it out, like one of those retrobulbar masses we just mentioned.
So something pushing from behind.
Exactly. And while exophthalmia can sometimes develop relatively quickly, it's typically not quite as sudden, not as peracute as proptosis caused by trauma often is. The eyelids also usually aren't trapped behind the globe in the same way.
That distinction is really helpful. Understanding what it isn't helps clarify what it is. So let's say the worst happens. You suspect proptosis. What are the absolute first things that need to be done? Time seems critical here.
It is absolutely critical. The information we reviewed is very clear. If there's any chance of saving the eye, getting it back into the socket, repositioning it needs to happen fast.
Okay, so speed is key. What are the immediate steps?
First things first, prevent any further harm. That means keeping the surface of the eye, the cornea, moist, use sterile lubricant, artificial tears, whatever is available,
Keep it lubricated. Got it.
and crucially, put an Elizabethan collar, an e-collar or cone on the animal immediately to stop them from pawing or rubbing at the eye, which they'll instinctively want to do.
Right. Stop self-trauma.
Exactly. Then, obviously, get to a veterinarian immediately. They'll focus on stabilizing the patient first, especially if there was major trauma, and do a thorough checkup before attempting any surgery on the eye itself.
Okay, protect the eye, stop the pet from making it worse, get vet help, stabilize. Then what about the actual procedure to put the eye back?
The goal is to do the repositioning procedure as soon as it's safely possible for the animal. This is usually done either with heavy sedation and local anesthetic, or if the animal's condition allows and it's stable, under general anesthesia.
Is it always straightforward to just push it back in?
Not always. Sometimes the vet might need to perform what's called a lateral canthotomy.
Canthotomy.
Yeah, it's basically a small surgical cut made at the outer corner of the eyelids. It helps to release some tension and gives a bit more room, makes it easier to get the eyeball back into the socket, but it's not always required.
Okay. And how do they physically maneuver the eye back in? It sounds incredibly delicate.
Oh, it is very delicate. The veterinarian will typically use specialized, quite fine instruments like eyelid forceps or maybe muscle hooks to gently grasp the edges of the eyelids.
Right.
Then, while being extremely careful not to damage the eyeball itself, they'll gently pull the eyelids forward, sort of up and away from the globe.
Pulling the lids out and over.
Exactly. While at the same time applying gentle, steady pressure to the front of the lubricated eyeball to push it back into the socket. The text even mentions sometimes using something smooth, like the lubricated handle of a scalpel or similar surgical instrument to help with that gentle pushing.
Wow. That requires a very skilled, gentle touch, I imagine.
Yeah.
What happens once it's back in place? You can't just leave it like that, surely.
No, absolutely not. Once the globe is successfully repositioned, the vet will place temporary stitches in the eyelids to hold them closed. This is called a temporary tarsorrhaphy.
Tarsorrhaphy.
It usually involves 2 or 3 sutures, often mattress sutures, placed across the eyelid margins, sometimes with little plastic stents or buttons to prevent the stitches from cutting into the skin. This keeps the eyelids shut, protecting the eye while it heals.
And that cut they might have made at the corner.
Right, the lateral canthotomy. If that was performed, it gets stitched closed as well.
One more thing you mentioned, checking the cornea. When does that happen?
Ah, good point. Yes, before attempting to reposition the globe, the vet will usually apply fluorescein stain to the cornea. It's a special dye that highlights any scratches or ulcers on the surface. That's important to know before you start.
Okay. Now, are there situations where trying to save the eye just isn't the right call? When removal is necessary?
Sadly, yes. Enucleation, which is the surgical removal of the eye, might be the best or only option in certain circumstances.
Such as?
Well, if the optic nerve, the nerve connecting the eye to the brain, is clearly severed, vision is impossible. Also, if more than two of the extraocular muscles, the ones that move the eye, are torn, that makes saving it very difficult and unlikely to function.
Okay. What else?
Other reasons would be if the eyeball itself is ruptured, or if it's become badly infected, or if it's been proptosed for too long and has become completely dried out and, well, non-viable.
That must be an incredibly difficult decision for everyone involved.
It really is. But sometimes it's the most humane course of action.
Moving on to recovery.
Yeah.
After the eye is either put back or sadly removed, what role do medications play?
Medications are definitely a key part of the management. Broad-spectrum antibiotics are almost always used.
To prevent infection.
Exactly. Given both systemically, so by mouth or injection, and topically as eye drops or ointment. Usually continued until any eyelid sutures are removed.
Okay. What else? Steroids.
Yes, corticosteroids often play a role. Systemic steroids given orally or by injection are frequently used initially to help reduce the significant swelling that occurs around and behind the eye. That might be continued for a while depending on the swelling.
Then eye drops.
Topical steroids, so steroid eye drops, might be used if there's inflammation inside the eye, uveitis, or maybe bleeding in the front chamber, hyphema. But, and this is a big but, only if there are no ulcers on the cornea.
Ah, right. Why not if there's an ulcer?
Steroids can significantly slow down corneal healing, so they're contraindicated if there's an ulcer present.
Good to know. Any other common eye drops?
Yes, topical atropine is often used. It helps to dilate the pupil, which can relieve pain from muscle spasms inside the eye associated with inflammation, and it also helps prevent the iris from sticking to the lens, a complication called synechia.
Okay, so antibiotics, steroids carefully used, and atropine. Are there other times when these meds shouldn't be used, besides the steroid ulcer issue?
Well, the other main caution is with systemic corticosteroids. They should generally be avoided if there's evidence or strong suspicion of an infection in the tissues around or behind the eye, like a peri- or retrobulbar abscess, because steroids can suppress the immune response needed to fight that infection.
That makes sense. Crucial details. So, after the initial surgery and starting meds, what does the follow-up care look like?
Regular rechecks are essential. Those temporary eyelid stitches, the tarsorrhaphy sutures, they're usually removed gradually.
Gradually, not all at once.
Often not. They might start removing some around 10 to 14 days after the surgery, depending on how things are healing, how much swelling is left. At that point, the vet will reassess the health and integrity of the globe, and importantly, try to determine if there's any vision present.
And for those flat-faced breeds we talked about earlier, is there anything else done long-term?
Yes, potentially. If a brachycephalic dog has had proptosis, the vet might discuss doing a preventative surgery later on, perhaps even on both eyes. It's called a permanent medial or lateral canthoplasty.
And what does that do?
It basically involves surgically shortening the eyelid opening, the palpebral fissure. Making that opening smaller can significantly reduce the risk of the eye proptosing again in the future.
That sounds like a really sensible preventative measure for those high-risk breeds.
It can be very effective, yes.
Now, even if the eye is saved, what are some of the potential problems or complications that might arise down the line?
Unfortunately, complications are relatively common even with successful repositioning. Blindness in the affected eye is probably the most frequent one.
Especially if the trauma was severe.
Exactly. Especially if it was significant trauma in a non-brachycephalic breed. Many animals, even if they retain the eye, will also end up with some degree of strabismus. The eye might not point straight ahead, often drifting outwards and upwards, and it might sit slightly more forward than the other eye.
Okay, so cosmetic and functional changes. Anything else?
Yes, decreased tear production is another potential issue. It's why Schirmer tear tests, which measure tear production, are usually performed after the sutures come out and periodically afterwards.
Low tears could cause dry eye, right?
Precisely. which leads to other problems. You can also get corneal denervation, meaning the nerves supplying the cornea are damaged. This can lead to something called neurotrophic keratitis, where the cornea doesn't heal well.
More cornea problems.
Yes, and related to that, or sometimes just due to the slightly altered position or eyelid function, you can get exposure keratitis, where parts of the cornea are chronically exposed and dry. And in some cases, over a longer period, the entire eyeball might gradually shrink and become non-functional. That's called phthisis bulbi.
Phthisis bulbi, shrinking of the eye. Wow.
So the really crucial takeaway regarding prognosis, I think, is that while we can often save the physical structure of the eye, preserving vision, particularly after major trauma, is definitely less certain.
Okay, so summing up the prognosis then. What's a general outlook people should be aware of?
Broadly speaking, the sources suggest that most proptosed eyes can be salvaged. Anatomically, they can be put back in. However, a significant number of those salvaged eyes will end up being blind, especially, as we said, if the proptosis was caused by major trauma, which is more common in the non-brachycephalic breeds.
And are there specific signs at the time of injury that suggest a really poor outlook for saving the eye or vision?
Yes. Things that indicate a grave prognosis include really extensive damage to the tissues around the eye, if the optic nerve is visibly damaged or avulsed, if multiple eye muscles are torn, the text mentions more than 2, usually means a poor prognosis, or if there are significant facial fractures around the orbit, or definitely if the cornea or sclera, the white part of the eye, is ruptured.
Okay, those are pretty clear negative indicators.
Yeah.
But are there positive signs, things that might suggest a better chance of keeping vision?
Yes, thankfully there are some indicators for a more favorable prognosis, specifically for vision.
Like what?
Things like seeing normal retinal blood vessels and a normal-looking optic nerve head when the vet examines the back of the eye, having normal pressure inside the eye, and importantly, a short time between the injury happening and the surgical repair. The quicker the better.
Makes sense. What about the eye's function?
If the animal still shows some visual reflexes, that's positive. Like a menace response blinking when something quickly approaches the eye, or a dazzle reflex, blinking in response to a very bright light. And assessing the pupillary light reflexes is key.
How so?
Specifically, checking the indirect pupillary light reflex. That's where you shine the light in the injured eye, but watch to see if the pupil in the healthy, uninjured eye constricts. If it does, it means the signal is getting from the injured eye back to the brain, which is a very good sign for optic nerve function.
That's a really important clinical detail, checking the other eye's response.
That's crucial, yes.
Now, what about the size of the pupil in the injured eye right at the beginning? Does a big pupil mean blindness, or a small one mean it's okay?
That's interesting because the sources actually suggest that the initial pupil size isn't always a reliable predictor of whether vision will return.
Oh, okay.
Well, a large dilated pupil, mydriasis, could indicate severe optic nerve damage, which would mean permanent blindness, but it could also be due to temporary damage to a different nerve, the oculomotor nerve, which controls the pupil size but doesn't directly impact vision itself.
So a big pupil isn't automatically a lost cause for vision.
Not necessarily on its own, no. And conversely, a small pupil, miosis, is often caused by the pain and inflammation inside the eye, the uveitis we mentioned.
Right.
Even if the pupil is constricted due to severe inflammation, there could still be underlying damage to the retina or optic nerve that will prevent vision from returning. So pupil size is just one piece of the puzzle, not the whole story.
Okay, that's a really helpful clarification. It gives us a much clearer, more nuanced picture of this very serious condition. So just to wrap up the key points, what are the absolute most important things for our listener to take away about proptosis?
I'd say 3 main things. First, it's serious. And remember, those flat-faced brachycephalic breeds are definitely more prone to it, sometimes even from minor incidents.
Right. Breed matters.
Second, if it happens, immediate veterinary attention is absolutely critical. Getting that eyeball lubricated, protected, and repositioned quickly offers the best possible chance. Time is of the essence.
Act fast.
And third, while the eye structure itself can often be saved, it's really important to have realistic expectations about vision. There's a significant risk of blindness, especially if the initial trauma was severe.
Okay. Seriousness.
Yeah.
Especially in certain breeds, act fast for treatment and be prepared for potential vision loss. Got it. This has been incredibly informative, really highlights the need to recognize these signs and, well, act immediately.
Hopefully useful.
And for you, our listener, we really hope this deep dive has given you that clear, comprehensive understanding you were looking for today.
Absolutely. And perhaps it leaves you with something to think about. A final thought, maybe.
Go for it.
Well, considering that trauma is the main cause of proptosis, it makes you wonder, doesn't it? What are some proactive steps you, as a pet owner, can take in your daily interactions and the environment you provide for your pets to maybe lower the risk of these kinds of injuries, especially if you happen to have one of those more susceptible breeds? It's definitely worth considering how we can help keep our companions safe from this kind of traumatic event.